Okay, in the health headline news, let's go on to the mixture of antibiotics. I promised I would talk about antibiotics for just a minute. Erythromycin is probably or otherwise called emycin, is undoubtedly one of the most commonly prescribed antibiotics there is. Typically, it's in a class of antibiotics along with Biaxin. Emycin and Biaxin basically work the same, and we, as doctors, will oftentimes recommend those drugs when someone is allergic to penicillin. Penicillin is really cheap. You should be able to get a prescription for penicillin for about $2.50. It's really a cheap drug. And fundamentally, it's what we call very broad spectrum, so it doesn't target one specific bug, it targets several. And so when we as doctors give an antibiotic, one of the things we do is we look for the type of bacteria that's infecting you, and then we try to get an antibiotic that's geared just for that bacteria. When we talk about erythromycin or Biaxin, those are very broad spectrum positive antibiotics that work on a whole host of bacteria. But fundamentally, you go to a doctor with a cold or a flu or an abscess of some sort, some infection, and the doctor writes your prescription for one of these antibiotics. Well, now we're tracking what happens. If you take either one of those antibiotics and you happen to be on a blood pressure drug called a calcium channel blocker, and just so you know what these are blood pressure drugs like Norvasc, Plendil, Procardia, Cardiazam. These are extremely popular blood pressure drugs. If you're taking one of those blood pressure drugs and then your doctor happens to write a prescription for you for emycin or Biaxin, statistically you can wind up in the hospital with drug toxicity because the antibiotic inhibits an enzyme that helps your body from breaking down your blood pressure drug. So you get high levels of blood pressure drug in your system and can get toxic and end up in the hospital. This is such a big concern that they say in the United States alone, in 2008, more than 66 million prescriptions were filled for antibiotics. So we really are still using antibiotics heavily, despite the CDC saying don't use them as frequently. So nonetheless, my message to our listeners is, if you are taking any type of calcium channel blocker for your blood pressure, Norvasc, Plendil, Procardia, Cardiazam, talk to your pharmacist and ask them if you're on a calcium channel blocker. Then I want you to make a note in your own little personal wallet that says you are allergic to erythromycin or Biaxin, emycin or Biaxin. Remember that, folks, because I promise you doctors don't remember this drug interaction, and pharmacists may not either. If you will remember this, you could potentially save your life.